When going down the stairs, you might be able to do it without a handrail.
Oh, really?
Where's the numbness?
My whole leg is numb. From the lower back to the knees, it's tingling. Below the knees, it feels like it's compressed. Especially the soles of my feet are painful and numb.
Is it hard to sense while walking?
Comparatively, yes. It is harder than before.
You mean compared to before the surgery?
Exactly. Now it's more challenging to walk, and the sensation is somewhat dulled.
Did the surgery make things worse?
Yes, indeed. When I first came here in June, I was walking 4,000 to 5,000 steps a day. Gradually, it reduced to around 2,000 steps.
And it decreased further in this short period?
That's right. I'm also afraid of falling, but it's mainly difficult to walk.
Has there been any improvement in urination or bowel movements?
In the last 2 to 3 weeks, I haven't needed help with bowel movements. But before that, even during my hospital stay, I needed assistance.
Lift your leg like this. (4.2 plus).
It's 8.8 kilogram.
Let's move to the right leg. 4.2 plus.
It's 7.2 kilogram.
Next, try kicking with your leg. That's strong, a 5. Now, let's try bending it. It's 5.2 minus.
(6.3 kilogram).
Bend your right leg. The right leg is a 5 minus.
8.5 kilogram. Right leg 8.8 kilogram to 10.1 kilogram. Left leg 11.6 kilogram. It went from 7.2 kilogram to 11.6 kilogram.
It's almost back to normal. Now let's try bending your legs.
6.3 kilogram to 10 kilogram. 8.5 kilogram to 11.1 kilogram.
Your strength has improved significantly. When you stand up, you can do it easily now. And there's stability when sitting. You might be able to go down the stairs without using a handrail.
Oh, really?
Could you not do that before?
I was using both a handrail and a cane.
Maybe just a handrail will be enough now. The legs have gained a lot of strength. I'm glad. Please wait 1 to 2 weeks for the numbness.
Understood.